to the Advancing Cross-Sector Collaborations Through Health and All Policies webinar. I am Allie Bain with the Iowa Cancer Consortium, and I will be hosting today's discussion. Today's webinar will be recorded and will be available on the consortium's website at www.canceririowa.org following today's presentations. So during today's webinar, we'll hear from 3 different presenters. First, we will hear from Dr. Len Novilla, who is an associate professor in the Department of Health Science at Brigham Young University in Utah, and she will be discussing deconstructing health in all policies, health as a common goal. Next, we will hear from Denise Attard-Sacco, who is a public health consultant and health educator, and she will be talking about social determinants of health and health impact assessments in using health lens analysis. And finally, we will hear from John Peterson, who is the health liaison for the Iowa chapter of the American Planning Association, and he will be discussing a project that's happening in Iowa, the Planning Healthy Communities Project. So a couple things before we get started. On the right side of your screen, you will see that there is a chat box, so feel free to ask questions throughout the presentations using the chat box, and we will provide those to the presenters at the end. If you have any technical difficulties at all throughout the presentations, please let me know using the chat tool, and we'll try and get all of those figured out for you. All right, I think that we are ready to begin. If everybody would like to type in the chat tool the organization that they are with and their role there, just so we can kind of get a look at who is involved with our meeting today, we would appreciate it. And Dr. Novilla, you can feel free to get started.
Okay, thank you so much, Allie. Good morning, Iowa. What a pleasure to be with you today. Thank you for joining Denise, John, and myself for this webinar. We would also like to thank Allie and our friends at the Iowa Cancer Consortium for making this webinar happen. Having the Iowa State Capitol as the backdrop on discussing health in all policies is intentional. At the heart of health in all policies is leadership across sectors and at all levels of government. By deconstructing or analyzing the health in all policies into its basic elements, we hope that this webinar will help inspire ideas on how public health and environmental health professionals can link their efforts with planners and with other sectors for a healthier Iowa. To start deconstructing health in all policies and the concepts related to it, let me give you a minute to try matching these terms with their definitions. Okay, for number 1, if you answered health in all policies, which is letter B, you are correct. It's the approach to public policies that systematically account for the health implications of decisions. For number 2, that will be letter C, health inequities, the unjust, unacceptable, avoidable differences in health status. And number 3 will be cross-sectoral collaboration, or letter E, working together across sectors and disciplines for shared solutions in addressing health and social issues. Both number 4 and number 5 all refer to social determinants of health, which are the conditions in which people are born, grow, live, work, and age. And they are the ones that are mostly responsible for the disparities in health. And last but not least, that will be health impact assessment, a tool for determining the effect on health of policies, plans, and projects using quantitative, qualitative, and participatory techniques. The roots of our problems lie in how we organize our affairs in society. The social, economic, political, and environmental factors around us, or the social determinants of health. All these affect the health of individuals and families in our communities. And the existence and persistence of these social determinants are influenced by money, power and resources, which then give rise to inequities in health. This is from the World Health Organization, a conceptual framework to guide our action on the social determinants of health. If you look here at the first two columns on the left side of your screen, these are the structural determinants of health, which collectively are really how we manage our affairs in society. This means policies, education, occupation, income, and other social factors that shape the distribution of money, power, and resources in our society. At times, these factors may seem distant to the individual and the family. However, they eventually affect equity as well as individual well-being. Health disparities and health inequities. Although both terms are used synonymously, health inequities actually carry a moral and ethical dimension. That is, these are differences that are unjust and avoidable. A commonly used definition for health in all policies comes from the 8th Global Conference on Health Promotion in Finland, the Helsinki Statement on Health in All Policies, and it states that health in all policies is an approach to public policies across sectors that systematically takes into account the health implications of decisions, seeks synergies, and avoids harmful health impacts in order to improve population health and health equity. What is important about this definition is that, first of all, it emphasizes the accountability of policymakers at all levels, and also that public policies actually have consequences on health and well-being. In 2012, this definition of health in all policies was published to guide local and state governments. That is, health in all policies is a collaborative approach to improving the health of all people by incorporating health considerations into decision-making across sectors and policy areas. Many communities face a variety of complex issues that no one sector can solve these issues alone. We need to incorporate health considerations into the decision-making process across sectors to innovatively tackle problems. Why health in all policies? First of all, we co-produce health. Policies made in all sectors can have a profound effect on population health and health equity. Second, health is the responsibility of everyone, not just the health sector. Policies made in all sectors can have a profound impact on population health and health equity. And third, we need to change the policy environment, which means that we need to work in an environment where health is the priority and the measure of effective policymaking. This infographic came from the World Health Organization, and it emphasizes two main messages. First, we need good policies for good health. And second, various sectors can actually work together for equity in health opportunities. The CDC Health Community Initiative states, the way we design and build our communities can affect our physical and mental health. This reaffirms that the intersection between health, public health, environmental health, and urban planning is not only natural, but it is essential. So to determine how we can help strengthen the link between public health, environmental health, and the planning sector in Iowa, we explored how much these disciplines share a common language on health. So we surveyed members of the Iowa Public Health Association, the Iowa Environmental Health Association, and the Iowa chapter of the American Planning Association. Based on a self-assessed level of awareness, as you can see from the slide, public health and environmental health professionals consider themselves familiar with the concept of the social determinants of health. Planners consider themselves not as familiar, although much of their work help improve social and living factors. On the survey on health disparities, although respondents from all three disciplines consider themselves familiar with health disparities, still, you could see that there's a significant percentage of planners who consider themselves either not having heard or being slightly familiar with this concept. And then we did a Health in All Policies survey. How familiar are you with health in all policies? Now, these numbers are very revealing. Only public health respondents consider themselves either moderately to very familiar with this concept, which is a vital concept if we are to address the complex and wicked social issues that lead to health inequities. Now, the question, how familiar are you with the health impact assessment? Although public health professionals consider themselves familiar with the health impact assessment, you could really see a split here among those who know and those who either have not heard about it or consider themselves slightly familiar with a health impact assessment. Now, how about cross-sectoral collaboration? The very heart of the practice of health in all policies depends on working together. However, as we can see from the survey results, respondents across these three disciplines either have never heard about this approach or were only slightly familiar with the concept. Now, these next two slides, you will see planning terms used commonly by planners to design healthy communities. Now, you could see here that there are planning terms here that are never heard of for public health as well as environmental health professionals, and those terms are in red. Road diet, brownfield, grayfield, new urbanism, planned unit development, cluster development, traffic calming, transit-oriented development, and universal design. Now, which terms are public health respondents and environmental health respondents familiar with? Now, you could see the first bulleted point there, health disparities, social determinants of health, cultural competency, social justice. Environmental health and public health professionals were very familiar with this, and naturally so, because this is the very heart of what we do in public health and environmental health. However, we could still see that there are some terms that are much more familiar with environmental health professionals, such as setback, site planning, or building construction process. So let's go back to the question, how can we use the health in all policies approach to unify our efforts and address the health problems in Iowa? So I broke down here the basics of health in all policies. In fact, if we do a play on words, it will take us to the very core of health in all policies, meaning health in all policies is all in health, that is, all acting together in health, which is having health as the common goal of all sectors. So who are we targeting for health in all policies? We target leaders and policymakers using an approach in which we actually have a policy response to inequities in health. Where can we apply this to the whole of government and not just the public health or the health sector? And when can we do this? Before, during, and after policies and programs are made. How can we actually apply a health in all policies approach? This one came from NACCHO, and it is showing us a change in the systems to determine how decisions are made is actually health in all policies. At the very center is synchronizing our communications and messaging. And this is why our results show that we really need to have a common language for health. And in addition to that, we need to actually work together for health. So we can develop and structure cross-sector relationships. And then following that is enhancing workforce capacity, incorporating health into the decision-making process, and then coordinating funding and investments, and also working on our data systems, integrating, as well as also working on research and evaluation, and making sure that all of us are accountable for health. When we surveyed our environmental health as well as public health professionals, they actually came up with these recommendations on how we can effectively work together and apply a health in all policies approach. Among those that they mentioned is being together or having more face time for purposeful conversations and meetings, recognizing each other's role in health, and learning about each other's discipline, cross-training. Also, being educated in terms of the health issues outside of the acute care setting. And another important thing is sharing data and measures. Also, educating policymakers, specifically with the needs of rural and urban areas, and also letting them know that everything we do at the local level impacts health. And investing in collaboration by increasing funding and time to partner and focusing on rural areas. So what messages can you take home with you today? First of all, for a healthier Iowa, we need to work together for health. That is, we need the whole of government action. And we have a new and expanded role for public health. We are now to be the brokers, catalysts, animators, educators, and partners in a more participatory process. It is important that we reach out across sectors, learning about each other's work and building on each other's experiences so that we may be able to build healthy communities. This really means expanding our network of influence, which means breaking down walls or silos and also any unproductive work traditions. It is vital that we connect and intersect. This means that we have to invest in the why. We know the what already of strategies, but we at times forget the why. Why we do what we do and for whom. And this is to remind us that health extends beyond the borders of our disciplines. It has to be our common goal. And lastly, we need to communicate using a common language for health across disciplines. Thank you very much.
Thank you, Dr. Novella. Denise, you're next.
You hear me?
Yes, go ahead.
So good afternoon, everybody, and thank you for joining us. In this presentation, we shall be taking a look at how health impact assessment and health in all policy and health lens analysis can be used to address health determinants within the proposal. And when I say proposal, it can be a policy, project, or plan. So we'll also go through the HIA and HLA processes in brief and provide examples of their application, as well as some tips on how to get started with both health impact assessment and health lens analysis. So what is health? Health means physical, economic, emotional, and social well-being of individuals, families, and communities. And what shapes our health? As you have already heard from Dr. Novia's presentation, being healthy does not only implicate merely the absence of disease. Health is influenced and impacted by factors which are collectively known as the structural and social determinants of health, which in turn influence our behaviors and also determine the quality of life that we enjoy. And decisions taken on policies or projects that lie outside the health sector can all influence these health determinants, for better or worse. So how do health impact assessment or health lens analysis come into play? Well, using these tools, you can assess how your proposal may impact the social determinants of health and what health outcomes those impacts may lead to. And then through the HIA or HLA framework, you can determine what changes you need to make to the original proposal and to enhance any projected positive impacts it may have, or to mitigate or eliminate any negative ones. So let's start with health impact assessment. What is it anyway? So health impact assessment is a systematic process which uses data and analytical methods to consider the possible impacts of a proposal on a population's health, and also the distribution of those impacts. And through the HIA process, you also provide recommendations on how to manage those impacts. HIA has a number of key values, and these include enabling democracy. It engages and empowers communities, improving transparency in decision-making. It ensures equity, it highlights existing and potential health disparities, and through the process you come up with recommendations on how these may be addressed. It encourages sustainable development through the recommendations you make that lead to long-lasting protective interventions. It enables ethical use of evidence and also provides a comprehensive approach to health and health assessment. And its purpose, again, through the HIA process, you are engaging an empowering community. You are building those cross-sector collaborations and relationships, and you are improving transparency in the decision-making processes. And then through the HIA reporting itself, you are describing the health impacts of a particular proposal, you are highlighting any health disparities, and also providing recommendations. So HIA has been applied at various decision-making levels. The majority of HIA is taking place at the local level and in a number of areas, again with the majority undertaken in the built environment sector, as you can see in the diagram on the slide. So let's go through the HIA process in brief. It is composed of 6 steps: screening, scoping, assessment, recommendations, reporting, monitoring, and evaluation. And throughout the process, you can have stakeholder engagement. And we shall go through each and every step using the Trenton Farmers Market HIA as an example. So in this HIA, the UCLA HIA group and the Project for Public Spaces staff wanted to determine how modifications to the farmers market in Trenton, New Jersey may impact the health of local residents. And they considered 3 scenarios. Scenario 1, so they weren't going to do much change to the existing market, just some improved lighting and new wiring. Scenario 2, they wanted to give the market a whole facelift, change its exterior, expand the market, change its organization and infrastructure, and integrate it into the community, so making it like go-to place, a social hub. And in scenario 3, where they wanted other areas of the city, they wanted to reach other areas of the city by operating mobile vans, having satellite markets, and also conducted health educational outreach on healthy eating options. So the first step of the HIA is screening. Why conduct an HIA in the first place? Will it add value to the decisions that need to be taken? In this case, the need was to determine how each of the 3 scenarios would impact the health of the population served and help identify the best option or options. Another thing you need to consider in the screening stage is resources. Do you have the necessary resources to conduct the HIA, staff, funding, and time? And are your stakeholders engaged? Are they interested in being part of this decision-making process? Step 2, scoping. Here you define the focus of your HIA. What are your HIA questions? Which health determinants and associated health outcomes do you need to assess? In this case, the project team wanted to determine how the 3 different scenarios would impact the following: nutrition patterns of the market patrons, physical activity patterns of the patrons, opportunities for social mixing, potential economic benefits for vendors and patrons, and provision of public health preventive services. If we had to provide these services, which scenario would best support this the most? Another thing you want to consider during scoping is the populations that may be impacted by the proposal and by the decision at the end of the day. Can the decision give rise to health inequities? If this is the case, who would be impacted the most? Third step, which is scoping. I apologize, which is assessment. And here you are using your best available evidence. At this stage, you collect your data and determine baseline conditions. Once you have established your baseline conditions, you need to determine how your proposal will impact this baseline. At a minimum, you need to determine whether there will be no change, a positive change in health, or a negative health impact. If you want to go into more detailed assessment, you may even want to look into magnitude of the impact. Is it low, medium, or high? Its severity. Is it something that can be easily reversed, or is it something permanent? And its distribution. Are there populations that may be more negatively impacted than others? So in our example, this is what they came up with and what they found through their assessment. Improved access to fresh produce does not necessarily change consumption patterns. Necessary infrastructure in the neighborhoods surrounding the market is a requirement to encourage patrons to travel to market on foot or by bike. And a vibrant market does provide opportunities for socializing. With respect to economic benefits, increase in market patronage will benefit not only the vendors and producers, but may also have a positive economic spillover effect onto the surrounding community. And with respect to public health services, a vibrant market can be a source of providing these preventive health services, such as health screenings, healthy cooking demonstrations, and also nutrition education. So we're going to the fourth step, which is recommendations. So here, you should aim to maximize the positive impacts you have identified and mitigate or eliminate the negative ones. So in our example, looking at the three scenarios, scenario one, where they weren't going to do much change, they found that there would be no significant health impacts either way, neither positive nor negative. However, the recommendation for this scenario was, if you're just going to stick with this the same market, in order to increase consumption of fresh produce in low-income populations, you need to make sure that the fresh fruit and vegetable vendors accept food stamps, and that at the market itself, the prepared food vendors should be able to offer healthier choices. With respect to scenario two, where they were going to give the market a whole facelift and change the way it operates, it will lead to an increase in economic and social capital, as well as walking and walkability. However, making the produce available does not necessarily change consumption patterns. Looking at scenario three, where they were going to operate the mobile vans and the satellite markets, and also provide the educational outreach, they found that it would lead to an increase in fresh produce consumption, an increase in access in underserved areas. And so the final conclusion and recommendation was to combine scenario two with scenario three. So in that case, you will have the social hub, and the people can engage in walking and biking to the market. And at the same time, you're having the educational outreach, you're serving underserved areas, and you're changing consumption patterns. So just something brief about the last two steps of the health impact assessment process: reporting and monitoring and evaluation. So in reporting, you want to broadcast your findings and recommendations using different methods depending on whom your audience is, and you always want to make sure that your recommendations reach the decision makers before the final decision is taken. And monitoring and evaluation, this is actually conducted throughout the HIA process, and it helps to measure the effectiveness of the HIA itself, to determine whether your recommendations were included in the proposal, and if so, were they actually implemented, and what health outcomes did they eventually lead to. So let's shift our focus now on health lens analysis. So health lens analysis aims to identify key interactions and synergies between targets, policies, and strategies and population health, and ultimately deliver evidence-based recommendations that inform decision-making processes. Again, same as in health impact assessment, these recommendations should aim to maximize gains in health and to reduce or remove negative impacts on inequalities. Health lens analysis is composed of 5 elements as follows: engage, gather evidence, generate, navigate, and evaluate. And we shall be going into these a little further detail with an example. So areas where HLA has been applied: an active transportation analysis, transit-oriented development, water security. How does it differ from health impact assessment? So health lens analysis focuses on building those cross-sector relationships as a first step. On the other hand, the health impact assessment process first targets a particular policy, plan, or project, and then you build those cross-sector collaborations around that particular proposal. Okay, so let's take a quick look at an HLA example. The aim of this health lens analysis was to inform the draft South Australian Water Security Plan of the positive and negative health impacts of the reuse of stormwater, greywater, and rainwater for non-potable purposes. One of its main objectives was to strengthen partnerships between South Australia Health, the Office of Water Security, and a number of other agencies. So let's go into each and every element of the health lens analysis process. So the first step of the HLA process is engage. This entails reaching out to partners to build those cross-sector relationships. In this case, these were the South Australia Health, the Office of Water Security, and South Australia Community Health, etc. The second step, which is gather evidence. Here you identify the policy area or areas you want to work on in collaboration with other sectors, and then collect the necessary information and data to determine how that policy impacts health. So in this case, the Health Lens Analysis Policy Area focus was the draft South Australian Water Security Plan, and the stakeholders were interested in collecting information concerning health risks associated with an increased use of grey water, storm water, and roof water, positive health impacts and also positive health impacts of increasing the use of these alternative water sources. Third element of the Health Lens Analysis process, which is generate. Here you provide recommendations on how the policy may be made more conducive to positive health. In our example, they developed hypothetical scenarios and then drafted recommendations based on these scenarios. So in one example, they considered the following. For 7 out of every 10 households to reuse between 35 and 70 liters of grey water per week. So grey water is wastewater generated from bathrooms. It does not include, however, what is known as black water, which is water from toilets, etc. The recommendation they came up with was the following. Installation of neighborhood and community-scale grey water recycling schemes where water is collected from individual households and stored and treated in a communal system. The treated grey water would be used for irrigation of community recreation areas such as open parks and gardens. Fourth element of the Health Lens Analysis process, which is navigate. Here you are steering those recommendations through the decision-making processes. And final element, which is evaluate. You want to assess the effectiveness of your Health Lens Analysis process. You want to assess the strategies that you use, and you want to examine the impacts that the process has in terms of changing in knowledge, skills, and attitudes regarding health considerations and policy development in different areas. So we're nearly at the end. So some tips about how you can get started on both health impact assessment and Health Lens analysis. So with respect to HIA, identify a policy, project, a plan that would benefit from this type of assessment. And for Health Lens analysis, start building those cross-sector relationships. Reach out to government partners, agencies, and community organizations that will be interested in partnering to address specific health issues. Use existing data sources to examine potential connections to health, and do identify resources available and set up timelines. Do access HIA and Health Lens analysis tools available, and do participate in any training opportunities. And to help you with that, this final slide provides links. They're all hyperlinks, so you can easily access these when you get a copy of the presentation. And they do provide links to HIA, HLA, and also Health in All Policies resources, including training and tools that you can easily use. Thank you for your attention.
Thank you very much, Denise. John, are you ready to bring up the tail end here?
I am, Allie. Thank you.
Yep.
And thanks to all who've attended today for taking a bit of your lunch hour, perhaps, and allowing us to share this information with you all. I get the opportunity today to talk with you about a project that's occurring here in Iowa, about halfway through our time frame and going very well. Initially, I want to talk about the Plan for Health effort of the American Planning Association and the American Public Health Association. I think, Allie, you must have done that. Thank you. So the Plan for Health initiative started with the CDC and the recognition that the way we design our communities does have an impact on our health and the health of residents of those communities. CDC created a grants program in order to help fund collaborations and projects across the country. The American Planning Association was able to acquire that portion of that grant funding in an effort to bring together American Public Health Association and APA chapters. There's chapters pretty much in every state, to work toward not only collaborations but also projects. I think it was a recognition that if groups get together to share resources and have a goal of a project, the group gets stronger by working on something like that. So APA chapters and APHA affiliates were part of the local coalitions that could apply for funding from the American Planning Association in the Plan for Health program. And there's a resource there for you to use. Allie, could you advance the slides for me as I go? I'm apparently having trouble with that. There we go. Sorry. So the APA chapter applied for funding here in Iowa, working in collaboration with the Iowa Public Health Association. And our program, the Planning Healthy Iowa Communities, has several components and several collaborations within it, kind of a cascading collaboration. The key of the project, the APA Iowa chapter received $130,000 and worked with the Linn County Coalition to develop 2 different projects with a statewide component as a kind of a final phase or third phase. We have in Linn County, our coalitions, project leads the City of Marion, as well as the Hawkeye Community Action Program. Linn County Public Health, Iowa Public Health Association, API Iowa chapter were kind of lead agencies on the components of the project. In addition, we have coalition members from Blue Zones in both Marion and Cedar Rapids, the Corridor Metropolitan Planning Organization, the City of Cedar Rapids, Linn County Food Systems, and the Linn County Planning and Development Department. The Plan for Health budget was distributed amongst projects, so the Marion project includes several components, primarily focused on physical activity. In that project, we'll be developing active living guidelines, active transportation standards, and biophilic design standards. And then a final component is a toolkit that could be used by other communities to establish those standards in their communities. The Hawkeye Area Community Action Program received funding to create a food pantry training manual and then actually perform training of directors in the food pantries and map food pantry locations in order to identify where food deserts or gaps exist for people in the community, in the Linn County area, having access to food. And finally, the statewide effort, which is an effort to grow our collaboration to organizations across the state that influence the design of communities and the health of communities. So the grant components, again, you can see here what we're trying to create and how we'll spread that. The Hawkeye Area Community Action Program, the Nutrition Project, again, we'll be developing, and Anissa Berchot is our lead on that project and is doing a great job. At this point, we're wrapping up the guideline document and beginning to establish training times with food pantries across that area. If you think about food pantry locations, we have a broad range of food pantries, everywhere from established pantries that have distribution systems and perhaps a professional staff person and volunteers, all the way to churches that have established a food program as part of their ministry, and maybe it's someone in the church that's actually helping out with that. So broad range of training needs and and again, trying to encourage more nutritional food and in food pantries. Steps would include, in terms of collaboration, would include working with city planners to identify locations and access to locations, predominantly access to locations, to ensure that all of the members of the community have access to the network system for food. Why collaborate? It's very important to work together. The key behind the grant was to build these connections. We all seem to get caught up in our day, caught up in our world, and oftentimes don't think about reaching out, especially between planning and public health, reaching out to one another to assist one another and really bring value but also purpose to our efforts and what we do. The food system activities take up a significant amount of our land. If planners have an awareness of the incidence of hunger and the rising incidence of hunger in our country and our state, there's an opportunity to assist and understand the process better. It's both community-oriented and regional. There's awareness to healthy foods in low-income areas. There's statistics nationwide that show that we can identify where many of our chronic disease and obesity issues occur in our lower income neighborhoods, almost by zip code. Those determinations can be made. At the end of the day, our goal is to, through this recognition and through this program, to emerge stronger and have a more efficient and effective regional food system. Mapping, that's a horrible slide. I apologize for the quality of that slide. But again, the mapping of these food deserts and the ability to work to fill those gaps. So we work to train the trainers, empowering those food pantries to do a better job, provide more nutritional food to families, and be aware that they have an influence over not only food insecurity, but also the health of the population being served. Foods to Encourage, Feeding America is a national organization that we're using as a resource for a lot of information. And again, Foods to Encourage is encouraging those foods that are higher nutrition and encouraging people to make donations of foods that are of higher nutrition. Some of the strategies that are being employed in the guidelines will include nudge interventions, and I love this terminology. So we can't tell people what they should take, but we can nudge them to make better decisions by making higher nutritional food more available, more accessible, and more prominent in how it's displayed and how it's available to people. So we're nudging people to make better choices through a series of strategies. Some of those strategies include pre-packaging meals or bundling food items, not only to reduce waste, but also to provide a higher level of nutritional food in a package that a family can pick up at a pantry and use. Nutrition recipe cards, how do you cook healthier food? And so training on ways to make those healthier foods more available and easier to cook. Also front and center placement, so putting healthier foods and higher nutrition foods in locations where they're a first choice, where so a family might fill their bag early on. It's not unlike the grocery stores. If you stay around the outside edge, you typically have higher nutrition or healthier foods than if you go into the aisles where there's more processed foods. So making those a front and center choice and signing things so that people are able to do that. And then collaborating, working with city planners to engage the community about food security and food insecurities, to establish specific strategies to make things, healthier food more accessible and assess future planning so that we understand what neighborhoods may need more service than others. Also evaluating codes and requirements to ensure that these areas are available for our neighborhoods. There's physical structure that might need to be changed. There's perhaps transit routing that could be changed. There may be some zoning implications to the drawbacks that don't allow certain activities that would establish a pantry in a neighborhood that's underserved. So there's a lot of reasons for planners and food pantry directors to collaborate on those types of things. The second project that we're working on in Linn County is Activate Marion, and this is our physical activity project. Again, the primary components of the project are active design standards, active transportation design, and biophilic design. So think of active design standards as ensuring that if people want to make healthier, more active choices in their lives, the physical realm is available to them to do that there's no restrictions. Active transportation design standards, that's kind of a next level of complete streets. Complete streets being streets that are designed for all users and to use in a safe and comfortable manner. So active transportation design goes a little beyond that and says not only do we have the physical components of the street, but we've also created an atmosphere in that street corridor that encourages you to walk, perhaps to local stores, perhaps along an area that's shaded with trees or more comfortable to be involved in. And biophilic standards, which really draw out our innate relationship with nature and kind of the healing power of nature in our lives.
So John, it looks like somebody's having a little bit of trouble hearing you. If you could speak up a little bit, they would appreciate it.
Will do. Thank you.
Yep.
So when we started the work with Marion, one of the advantages we had really in Linn County were that Cedar Rapids and Marion were both Blue Zone communities. Blue Zone's a program in the state that assisted communities in trying to really be healthier communities. In Marion in particular, they have succeeded with a number of steps. You can kind of see their accomplishments on this slide. They've done a number of wonderful things associated with living a longer life and help them really be a candidate for the grant funding. So active living is defined as a way of life that integrates physical activity into daily routine. Again, active, first choice, and the infrastructure available to make that happen. So walking and bicycling, exercising, playing in a park, working in a yard, taking stairs instead of an elevator, using recreational facilities, and especially using recreational facilities, open school gyms in the evenings when the school's not using them, and shared use facilities help to encourage those kinds of things to happen. So as we design healthy communities, again, it's beyond just, oh, there's a sidewalk there. It's more about the sidewalk is inviting and encourages people to feel safe and use that sidewalk to move about in their lives. Urban design as a solution to our obesity epidemic. Again, many of our communities are not designed to encourage people to be outdoors, to be active, and to do anything other than get in their car and drive where they need to go. So one of the goals is to create some standards and create some neighborhoods and a community in Marion that will be a community that people choose to do that. The studies show that mixed-use neighborhoods generally are healthier than neighborhoods without a mix of uses because they do increase the likelihood of walking or biking. People that live in close proximity to parks have higher levels of physical activity. So ensuring that all of our neighborhoods and all of our residential areas have good access to public parks and open spaces. Bike infrastructure Communities with more bike infrastructure have lower obesity rates. It's easy to do the physical activity, to ride your bike around the community, and so you choose to do that, and that makes you healthier. Tree lawns contribute to perceptions of more walkable streets. So again, called a lot of different things. The parking area between the sidewalk and the street, if that's landscaped in a way that provides shade, provides protection from moving cars, people are more apt to use those sidewalks or pathways alongside the street and live healthier lives. So barriers, lack of sidewalks and connectivity. You can see the slides really don't encourage you to walk anywhere. Lack of safe pedestrian crossings of streets. This is one of the things that's probably more difficult than you might think, but creating an intersection of streets that a pedestrian feels comfortable moving across that still accommodates the traffic that it needs to accommodate. Access to natural areas or trails. If you have limited access, it's a barrier to people getting out and being active. Parks and community gathering spaces, a sterile environment or a lack of nature tends to not encourage people to be about and be active. And then again, bicycle lanes or bicycle facilities just to provide, if I choose to use an active form of transportation, the facilities are there that allow me to do that. So active design standards in an urban environment increase mixed-use development. That's a zoning matter that communities, in a planning matter that communities can take action about. Increase of parks and open spaces, while challenging, a lot of communities can work with developers to set aside parkland. In some cases, communities will need to purchase parkland, but be thoughtful about the way parks and open space are laid out and how accessible they are to neighborhoods and to the use of people and residents in the neighborhood. And we can also work with schools on that, associated with playgrounds at schools being available before and after school. Public plazas and gathering spaces, especially in commercial areas, creating places where people want to gather, that social aspect of our health and being able to safely and comfortably gather with others and share parts of our lives. Pedestrian pathways, street connectivity, and programmed streetscapes all add an element that allows us to choose a more active lifestyle. So active transportation, a means of getting around that is powered by human energy, primarily walking and bicycling. You can see in these slides we've got some examples of how active transportation can be done in communities to encourage people to either walk or bicycle. Standards for transportation, there are a number of standards books available. We're still working to get a variety of those standards encouraged in Iowa. Bicycle networks and connectivity, check in your communities. Do you have a bike plan or a walk or a bike walk plan as part of the comprehensive plan in the community? Does the city set aside funding for projects that encourage connectivity and networks to be established, that whole bicycle infrastructure or walking infrastructure? Transit and transit development. I know many communities in Iowa don't have options for transit, but that's a matter of also studying where people might want to be going and trying to make opportunities available to people to get there in a way that doesn't involve getting in a car and driving. Traffic calming, slowing traffic down to make it more comfortable for bicyclists and pedestrians, and parking lot standards that encourage not only maybe lower parking numbers, but also encourage movement through a parking lot to get to a store or to get to the front door of a business that's for a pedestrian or a bicyclist. So finally, the last component of the project is to create these toolkits that we can spread across the state, and that's our statewide effort. We are really anxious to meet with other coalitions and other collaborators, the design community across the state, engineers, architects, landscape architects, other health professionals across the state. We're working to encourage connection. Lynn talked about the study that we did, the survey that we did, and kind of a lack of understanding of terminology. It starts with a common language. We're working to try to fill gaps, knowledge gaps, and capacity, and increase capacity for people to work together in collaborations. Denise talked a little bit about the processes that we can use to work together, and I would hazard a guess that most planners are unaware of health impact analysis, health and health policies, and health lens analysis. Again, part of our effort is to bring that forward, as well as the results of these two projects in this toolkit that we're trying to create, and the guidelines that can be used by other food pantries. Finally, why is Planning Healthy Iowa Communities different? Again, our effort is to collaborate, to work together, share resources, share energy, share funding, and try to connect planners with public health across the state of Iowa so that we bring purpose again to what we do, but also we bring allies to the table with a real clear understanding of how we can help prevent chronic disease and reduce obesity in our state. So thank you for your time. I think we've got a chance now to open things up to questions. So I'll turn it back over to Allie.
Yes. Well, thank you very much, John, and thank you to all of our presenters. As John mentioned, now is time for questions. So if you do have questions for any of our presenters, please feel free to type them into the chat box on the screen. A couple reminders while I let you guys type any questions that you have. There is an upcoming webinar that is based off of the survey that this team has done. So that will be on November 10th. And it will be called Let's Talk About Planning, Terminology, Processes, and Collaboration. And you can register for that the same way that you registered for this webinar. All right. Do we have any questions for the presenters?
Allie, I just want to put in a reminder about that we're drafting a document which will include information on cross-sector collaborations that are taking place and also include planning terminology and explanations thereof within this document, and we shall be uploading this to the second webinar.
Okay, perfect. And these slides will all be available, and like I mentioned at the beginning of the webinar, the recording will be sent for you guys to share within your networks. So the first question is, what specific next steps would Dr. Novilla recommend for public health and planners to advance our collaboration?
That's actually a very good question. One of the things that even public health respondents already recommended is that we have more face time. And at times there will be limitations on this, primarily because each of us in our own departments, in our own organizations and workplaces are subject to policies and procedures within that. But if we could actually start talking to leaders, directors in our own respective workplaces, letting them know more about health and all policies and how that could actually benefit not just the communities, but actually down to the level of families as well as individuals we have in the communities that we serve, that will actually be very good. So another thing is also not just sounding this out to our leaders, but also showing them data. Much of what we do in public health and environmental health we already have the data. But the thing is, we're not able to maximally share the data with other sectors. Like, say, with the data that we have in public health, how can planners step in? Or who is not yet at the table but should be? What are their thoughts? So we need to actually have more face time. And of course, as the results show, we need to have a common language for health. It's so hard to actually be unified in our efforts when we don't have that common language to bring us together.
Great. Thank you, Dr. Novella.
Oh, thank you too.
There was a great resource that was shared during the presentation about the Minnesota Department of Health offering some health impact assessment training, so I will be sure to share that resource whenever I send out this information to you guys. One other thing that I will mention is a survey will be sent to you, just asking you to give us some feedback about the presentations today. So we'd really appreciate if you would fill that out. It will come up automatically in your browser, so we would appreciate if you would fill that out. Do we have other questions? Yes. So the next question is, as legislators ask us what we might have them do around health and all policies, would you suggest we request the creation of a task force or a requirement of a health impact assessment on proposed legislation? Dr. Novella or Denise, do either one of you want to take a stab at that?
I'll jump in and then let Denise actually take a stab at it too. Yes, with a resounding yes. Health lens analysis, for instance, the one that Denise talked about, actually started from the top down. There is a very important, it's so important that policymakers are actually involved, and having, a task force to help with that will actually be important. When I was talking about health in all policies, the guide to state and local governments actually came as a result of the experience of California, particularly Richmond, California. It is the first here in the United States that actually practice a health in all policies approach using a health impact assessment. And what they did was to actually put together a task force, which then expanded its influence as well as its reach toward policymakers. And policymakers were actually an integral part of that task force. So I would say it's a resounding yes. And Denise?
Yes. So talking about the health lens analysis, and this first step in the process is building those cross-sector collaborations. Very important, yes, to create those task forces. Requirement of a health impact assessment on proposed legislation. Now, I know Iowa legislation, I stand to be corrected, but the Iowa Department of Public Health may request a health impact assessment to be conducted on a particular project, policy, or plan. But there isn't that, what is the correct term? It's not a legal requirement. It may, but there isn't that should be conducted, etc. There isn't the language for that in the legislation. And again, when you think about health impact assessment, always think about whether it's the correct route to take. So for example, there are instances where if an HIA is not going to add any value to the decision-making process, or it is not going to influence the decision makers, or there isn't sufficient time to conduct it, then maybe HIA is not the correct way to go. Start building those cross-sector collaborations first and generating that culture of health, and then identify if is the HIA is the route you want to take, or whether you want to continue with the health lens analysis route. And also, with respect to health impact assessment, when we say time is a limiting factor, etc., so there are different methods of HIA. So for example, you may want to do a rapid HIA because something is coming up and the decision needs to be taken sooner rather than later, and there isn't time to do a comprehensive assessment. So at least you do get in assess some health impacts. Maybe you won't be able to do the whole comprehensive HIA, but at least you get the health at the table and talk about certain impacts that the proposal may have on health outcomes, on health determinants, and can lead to certain health outcomes.
So the next question is, could you describe again the difference between HIA, the Health Impact Assessment, and HLA, the Health Lens Analysis, and when each might be used?
So health impact assessment, as I said, it assesses a particular proposal, which is policy, project, or plan. And then you build the collaborations, cross-sector collaborations around that particular proposal. Health lens analysis, the primary objective is to first reach out across sectors and build those relationships, and then identify areas and issues which you can work together on, and identify projects that you may impact with the cross-sector collaboration. Well, where you can, which is best to use, again, as I said, it depends on the situation. If there isn't much knowledge out there in the community on health, on how different sectors may impact health, start first with those cross-sector collaborations. Start building those relationships to gender, to build that culture of health within your communities, and then choose which route you want to go. If you already have those cross-sector collaborations in place, and you know there's a particular policy which would benefit from a health impact assessment, then go for the health impact assessment.
Oh, Allie, may I chime in?
Absolutely.
A traditional health impact assessment usually is done before a bill or a legislation actually is passed, so that you would like to find out how a proposed bill or law will eventually impact or influence health in the community. On the other hand, in the health lens analysis, which was pioneered in Australia, as already Denise mentioned, it was actually in Adelaide, which is part of South Australia. And I was there when they were actually doing their health lens analysis. The beauty about a health lens analysis is that it's not actually limited by the timing of the bill. Okay, one can actually do a health lens analysis even after a bill has passed, so that it's more of an evolving assessment or evaluation of how that bill, which eventually turned into a law, continuously impact a community or a group of people in the community. But both can actually be used as tools in order to assess social factors or social concerns that eventually also influence health.
All right.
And Allie, I would just chime in. This is John. I would just chime in and say that I think both of the processes can be built into planning processes, whether it be the preparation or strategic planning that a community might do in comprehensive planning, but also on a project basis in particular neighborhoods in an area where a study can be done. But again, I can't stress enough that I think it all really starts with a phone call and a face-to-face connection between a planner and a public health professional, and grows from there. When I started learning more about the impacts of health and public health statistics, probably 5, 6, 7 years ago, and it's for this little planner, it was an awakening really as to purpose again, and why we need to be thoughtful and why we need to understand the implications of all of the actions that a community takes related to planning and development, and how those affect the lives of people and primarily the health of people.
Allie, may I quickly jump in? And I'll make it quick. A lot of us in public health and perhaps in environmental health at times don't know where to start. Actually, we already have relationships in terms of our relationships with each other, our relationships with policymakers, and One thing that has really been very helpful for me to remember and to have learned in public health is to nurture those relationships, establish those relationships, and nurture those relationships. Truly, there is truth in that saying that at times, people really don't care how much you know until they know how much you care. And that is so true, especially as we work with communities. We need to actually find out, first of all, who is not at the table and who should be at the table. And we need to give voices to our communities. Thank you.
Thank you, Dr. Novella, and thank you to all of our presenters today. We greatly appreciate your knowledge and expertise. We have a couple minutes left. Do we have any other questions? All right. Well, thank you again to our presenters today. We greatly appreciate it. If you guys do have any other questions that you think of for the presenters, their contact information will be included with the recording. And we look forward to seeing you all at the next webinar on the 10th. So thank you very much, everyone.
Thank you.